Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be going over a patient. This patient had severe crowding and he had a missing tooth, so we're going to show you his before pictures, all the issues he had. We'll talk about how we resolve these issues. So if you haven't yet, make sure to like and subscribe to the channel. If you live in the Phoenix, Arizona area, we do offer free consultations for braces or Invisalign, so let's get into it. Alright, so this is our patient here. You can see he has quite a few issues, so we're going to jump to this next slide. Alright, in this one we're going to highlight the issues that we're going to discuss. So up top, you can see he has totally blocked out canines. So you can see the canines are up here, and this is about 8.5 millimeter tooth, and you can see he's got probably less than 0.5 millimeter space. So we got a big discrepancy there. Same thing over here, a big tooth out here, and maybe just like 1.5 millimeters of space. If you look at the lower midline here, you can see it's shifted to the right. And the reason is, when he was younger, he actually lost a lower first molar. And so all the teeth on the bottom have kind of drifted this direction. And normally this would be where what's called the 6-year-old molar goes. This is his 12-year-old molar. So as that 12-year-old molar grew in, it kind of grew in and drifted forward. And on this side, he has both his molars. So that's why on this lower right side, he doesn't have much crowding, because that tooth was lost early on. All the teeth kind of shifted that direction, and then over here you can see he's got quite a bit of crowding. He also has what's called a posterior crossbite, where the top teeth are inside of the bottom teeth, and his upper jaw is too narrow relative to the bottom teeth. And so those were the issues we saw right when we first came in. Alright, so here is that area on the lower right we were discussing, where he's missing that lower first molar. You can see on this side he's got 2 molars, this side he's just got the 1. So this tooth is drifted forward. These are the wisdom teeth back here. And so you can see all this space in the bone down here. This is normally where a tooth would be occupied. If you can see closely, there's actually the outline of the old root, and the bone is filled in that area. And then if you look up top in this circle, you can see he actually has an extra tooth. And so this tooth you can see is up in kind of the upper jaw area, up under the nose, and it's kind of pointing upwards towards his nose. So a little bit unusual, but we'll see that from time to time. So this is why they actually came in, is their dentist identified this. They sent us in to kind of diagnose what else is going on, what's the best course of action to take care of this tooth, and then also, you know, all the other things we discussed with that missing tooth, and then those canines that are blocked out, and the bite in the back. So like I said, this patient's got quite a few things going on. We're going to talk about each one and how we got those resolved. So our problem list: he's got the extra tooth, he's missing his lower right molar, he has severe crowding on his upper arch, and he has a posterior crossbite. And so that's where the upper arch is too narrow. So this extra tooth, it's pretty simple to resolve. We send him to an oral surgeon. The oral surgeon gets a 3D x-ray, he finds the best course and path to go find it, and he'll go and get that tooth out of the way. The reason that we don't want to just leave that in there is that as this root develops, sometimes the root will grow and affect the other teeth that are there, and it could potentially cause damage to those other teeth. Also, we want to get it out when it's really small. That way you don't have to go dig and take out a really big tooth. It's much easier to get it out when it's smaller like this. Additionally, sometimes unerupted teeth can cause cysts, and so again, that doesn't always happen, but because there is a risk, it's always better if you identify these to have them out as early as possible. So the oral surgeon, he took care of that for us. And then for his crossbite, we decided to use what's called a quad helix expander. So there's different types of expanders. For less severe types, we'll sometimes use what's called a quad helix. And so this is what that looks like. It's kind of a spring-loaded device. It goes in there and just kind of widens out that upper arch. And so we used that for about the first, I think, 6 months of treatment while he was in treatment with us. And that just widened out that upper arch, and that was fixed pretty easily. And now let's discuss what we're going to do about these upper canines that are blocked out. So we didn't feel like we had enough space to get all the teeth in. If we were to try to put braces on and push all these teeth forward in order to make space for that canine, what's going to happen is those front teeth end up getting really flared out. It's not really an aesthetic look, and it's not something that, sometimes we'll try to do that depending on the case, but this case we felt like it would be way too much pushing those teeth forward in order to get those canines to fit in. So, and then on the bottom we had this space here, and the midline shifted. So we decided to do some extractions on this case. So this animation will show how the top extractions work. So you can see if you have blocked out canines, you can take out the bicuspid right behind the canine, do braces, and you can direct those canines down into that spot. That was essentially what we did, is we had this tooth and this tooth extracted, then we did braces and we were able to bring those down. The reason we don't like to take out the canines when we can help it is that we usually are used to seeing those canines in position. That's what kind of gives a nice cosmetic smile. And you have two sets of these bicuspids, so if we can take one set out, bring the canines in, it's really hard to notice that any teeth are missing because it looks like a really natural smile that we're used to seeing. And then on the bottom, we decided to take out one bicuspid as well. So our goal was we wanted to bring these teeth forward and bring this molar forward, close this space, that way he doesn't have to replace that tooth down the road. But in order to get the midline to not shift further, we took this tooth out and then we closed that space at the same time we're closing this space. So essentially this patient's going to have two teeth out on the top, two teeth out on the bottom. Just on the bottom he was already missing one of the teeth, so we only had to take out one on the bottom. So he ended up getting 3 teeth out total, and then we did the quad helix and the expander, and he got that extra tooth out as well. So this is the patient when we started. Just to review the problems, he had lack of space there, missing a tooth there, lower midline is shifted to the right. And then this is the patient when we got finished. And so you can see all of the space is closed up top, all of the space is closed on the bottom. You can see all the molars have come together. We were able to fix the crossbite, get the expansion we needed. You can see his gums and these white spots. He did not have the best hygiene. Some of our teenage, male patients especially, tend to not be the greatest of brushers, so the gums will go down over time. This is going to look much better probably in a couple months. This little white spot, a lot of times those will remineralize. It should be okay. So again, this case, right now doesn't look great. In a couple months it's going to look even better. But here are some before and afters. You can see we were able to bring those canines down. They're looking much better. We were able to get all the space closed. You can see by the time we're done, you can't really tell that any teeth were missing. From his smiling pictures, you can see it looks so much better. He doesn't have these canines hanging out up top. And he's got a nice cosmetic smile. So that was our treatment. So let us know what you think. If you have any questions, ask them in the comment section below. If you haven't yet, make sure to like and subscribe to the channel. If you live in the Phoenix, Arizona area, we do offer free consultations for braces or Invisalign. Check out the link in the description or visit our website at yourazbraces.com. And we look forward to talking to you soon. Thank you so much. Bye-bye.